Welcome everyone. Today I gonna discuss about a mission of healthcare. Uh, Assist standard communication by the developing and funding involve strategies for improved access to healthcare, quality of healthcare, cost effective of the healthcare. Uh, Program and ORH placement and HPSA service. Uh, Recruit, provide and designer health professional shortage area. NC Rural Health Center support state designer rural healthcare that disturb the entire community. NC Community Health Grant support the primary care safety net system with increased access to healthcare for vulnerable populations. NC Framework Health Program support medicine, dental, and educational service for members of the North Carolina Agricultural Labor Force and their families. Rural Health Information Technology Program provide technical assistance to improve the use of electronic health records system and the use of the health information exchange. So these are the very important aspects uh, that we can care about healthcare. In a hospital program funds operation improvement project for the benefit of all critical access hospital and eligible small rural hospital. Medical assistance program provide free and low cost medical donated by the pharmaceutical manufacturer to patients who cannot afford them. Support evaluations of patients through video conference and technology in emergency departments, support data analytics shortage, uh, designations and pioneer effects to improve health. Program reach 100 total covers. Service area for NC Oath. Learn the definitions of telegraph, discuss the primary model for telephone, review medicine, show example of telehealth in NC, discuss broadband as is related to telephones. Does telehealth is equal to telemedicine? The Health Resource Service Administration defined telehealth as the use of electronic information and telecommunication technology to support long-distance clinical healthcare, patients, and professional health-related education, public health, and health administration. Technology include video conferencing, the internet, store and forward image, streaming media, and terrestrials and wireless communication. Uh, Telehealth is different from telemedicine because it refers to broader scope of remote telehealth services in telemedicine. Medicare telecom deflation, real-time interactive video, social must be rural's original sites, geographic and faculty distance provides synchronized two-way video. Organization site is the located where the medical beneficiaries or patients. The beneficiary must go to the original site for service located in either a country outside a metropolitan statistics, a rural health problem storage area. Original site physics and practical officer hospital, critical access hospital, rural health clinic, federation qualified health centers, hospital based or CAH based rental dialysis centers, skilled nursing facility, community mental health center. So, beside that, being in January 2019, the original site, geographic conditions and the added eligible organization site for an actual stroke. CMS does not apply original site geographic conditions to hospitalized, hospital-based and CAH-based rental dialysis center, renal dialysis facilities, and beneficiary homes when practitioner furnish monthly homes dialysis. Uh, CMS added an individual home as a permissible originated telehealth service site for treatments of a substance use disorder or a co-curriculum mental health disorder. Approved site practitioner, physical nursing practitioner, physician assistant, certified nurse, midwives, clinical specialists, critical RNA registered, telehealth, video conference store and forward, mobile health remote patent. Video conferencing. Mainly things can get into the way of getting into the sea of the doctor. Transportations can be expensive and time consuming. Inability to get time off from work, lack of specialty, provide specialty in rural and underserved area, decrease obstacle to patient access of the healthcare, address the mental health needs for EDs without access to the physical specialties. The NC statewide programs was developed in response to Sessions law. Uh, Beside that, they have different kind of interesting initiative. Mr. Alex, can you hear me?
Thank you, Mr. President. I can hear you quite well. Good afternoon.
Yes, you are. Yeah, good afternoon. You are healthcare worker, right?
Yes, please.
Oh, okay. So, as you are a healthcare worker, can you share your experience and some policy and strategy of healthcare in your country?
Um, Thank you once again. Well, this one it's fairly broad, I would say. Starting from the ministerial level, like the region where I'm working at the moment, when we do have uh, uh, issues of public health concern, what happens is that we do get a, a set of guidelines from the ministry. And a case in point was, for example, when we had the COVID outbreak recently from February 2020. So the ministry came up with a set of standards in which all of us as healthcare workers, we were to adhere to them, and indeed for the general safety of the public. Apart from that, when we come to like hospitals in general, um, we do have measures that we have put in place just to generally ensure that there is a safety for those ones who might be seeking the health service within the health sector. And for example, where I do work, we have our own internal measures that we have put in place. Let's say, for example, when it comes to visitations of patients within the hospital setup, we and this was indeed linked even to from the time we had COVID. We have limited the number of let's say visitors that are coming to see our sick patients in the hospital, and particularly for me who works in a critical care unit. You find that we could have those cross infections that might be brought along by, let's say, visitors and relatives who come to visit the patients. So apart from that, we have also put standards and measures whereby once the relatives or the family members do come to the hospital, we make sure that they are able to undergo like health information, sanitization procedures just before they visit, and we also even limit the number of time that they are supposed to be in contact with their loved ones in the hospital. And then further from that, we have developed policies within the hospital whereby people do attend what we call continuous medical education, and topics of interest are usually people are brought on board from different fields to impact the health workers, the health community. with the information, and this information is just to make sure that we are well kept abreast with the current management and knowledge in terms of disease management and the surveillance that is happening. So that is what I would initially want to share at this point in time.
Okay, thank you. So I'm trying to giving you an example of the some good things in stores and forward systems. It's a good model of healthcare system. Rural provider transmit secure health information to external specialties in order to seek uh, so a rural providers could send a patient's X-ray image to a specialist through secure channel and receive a diagnosis through email. Some store and forward systems are conducted through electronic health record. Clinical information flow. More than 70% of the routine specialist referred can be replaced by store and forward. Improve quality. 72% of the e-consult. Improve provide treatment plans. Decrease times. Decrease 19 days of wait time to specialty appointed. A model for teledermatology service is a community health centers. Objective evaluate the impact of implementing teledermatology consultation program with dermoscopy of a statewide scales for skin cancers. These are different kind of diagnosis process uh, for healthcare. Remote patient monitoring. Remote patients monitoring is a subcategory of telehealth that allow patients to use mobile medicine devices and technology to gather health data and send it to the healthcare professionals. Common psychology data that can be collected with RPM program include weight, blood pressures, and heart rate. Patients with chronic conditions face worse health outcomes, have higher hospital readmits rates, and generally include higher healthcare expenses. There are tools currently available that identify data trend. Chronic conditions, M Health. So now healthcare is mHealth. What is mHealth? mHealth is a abbreviation of mobile health, a term used for practice of medicine supported by the mobile devices. The term is most commonly used in reference to using mobile communication device, mobile phone, tablet computer, wearable devices such as watch. mHealth mobile store and forward video conference, remote monitoring information, medical office visit, emergency room referral, family notification. Reimbursement of telemedicine. So, so what is the present situation right now in Africa, especially the telemedicine? Do you use
Thank you.
telemedicine?
Yeah, thank you once again. Yeah, telemedicine is a concept that is fairly well developed and now within our boundaries. Pre-COVID, and indeed when we did have the pandemic, we had a situation whereby we could link up with some of our colleagues who are not within this part of the world, let's say from Asia, and we have those particular services within our hospital, whereby we have conference rooms which are just set with tech uh, online services, whereby you can link up with the people who are outside Africa, for example, and you can have a sharing of information. Apart from that, also well aware of a situation in Rwanda, where they have come up with the innovative measures of let, let, let's say transporting blood. If someone needs blood from one particular region, that blood is sent robotically or through devices which are able now to just carry that with the information, and then those components of bloods can reach quite a distance. So it is an innovation which came through from Rwanda, and most of the African countries have. I know of Kenya; they have also started embracing that one as well, so that because of traffic jams, for example, and other situations other situations whereby you find that you need to supply things very fast to a particular region, then this kind of a system has come in quite handy. Thanks so much, Mr. President.
Okay,
Uh,
thank you. Thank you. So at present, actually, healthcare is a very important, and especially we can move with this healthcare, medicine, social cares, and many important aspects. And if we can work in that particular area, so we need to do more research. We need to go for more product innovation and medicine innovations. We need to go for more developments of human progressions. We need to develop better strategy for healthcare system, better education system. So this is the objective right now, even World Talent Economy Forum working on this. So I request, can you develop a case study on African Rwanda healthcare system? So if you develop the Rwanda healthcare system, the case study you can forward to me, and we can
okay,
work together. Okay, we can work together.
around healthcare system. Okay, I'll be able to do that, Mr. President, and
Okay, okay,
in the fullness of time, I'll be able to share it with you and together with the other students.
okay. So if the other student can join, it will be more effective. So
Yes,
thank you for joining today.
yeah. And as per the assignment you gave us yesterday, are we to
Yes,
share it today?
yes, you can share.
Um, I just came up with some points that I came across as I was trying to go through this topic. I picked from where you taught us that sustainable development goals are a collection of 17 interlinked goals which were designed to be a blueprint to achieve a better and a more sustainable future for all. They were set up by United Nations in around 2015, and they were to be achieved by the year 2030. So the topic that you gave me to look at then comes under goal number 7, and this one was to ensure access to affordable, reliable, and modern energy for all. Access to affordable and reliable, sustainable energy is crucial in achieving many of the SDGs, from poverty eradication via advancements in health and education, water supply, industrialization, to mitigating climate change. So, energy access, however, varies widely across countries, let's say in Africa and indeed in the rest of the world. The current rate of the progress falls short of what will be required to achieve the SDG number 7. So an increasing proportion of the population have gained access to electricity, and we have worldwide about 1.1 billion people who are already connected to electricity. No, over 1 billion who are connected to electricity. But however, we have also a good proportion of people who are yet to be connected to the same. In Africa, and in particularly in sub-Saharan Africa, over 65% of the population are living without electricity. And of those gaining access to electricity worldwide, and particularly in Africa, vast majority of them, which is about 80%, are urban dwellers. So looking at sorry, Mr. President, there is an incoming call on my phone that is distracting me a bit. So looking at the past majority of the innovations in sub-Saharan African villages, African villages have managed to bring a stable, affordable electricity to a big part of the population within where they are living. And this one, looking at it from the few areas I was able to see, they range from a single light in some homes to home systems that can charge phones, televisions, run televisions, run fans, and that kind of a situation. Then part of what I was to look at was particularly a case scenario whereby it is either within this region or somewhere near where I particularly know. So I came across a situation in Malawi. There was a young man in Malawi, and this was in 2007. He was identified, and he became a global sensation. And what he did was that he was coming from a very poor background, a family of 7. He was the only boy. And in that part of the world, they sometimes face harsh climate conditions. In this particular case, there was a famine which had come across. It was in 2001. So this boy had to drop out of school because the family was generally relying on maize production, and this was not just for food. It was for economic purpose, and that is what the boy used to get like a financial support, because most of the schools in that part of the area, in secondary schools, they pay fees. So he had even to drop out of school. So what this boy did, he went from dropping to school, then he was faced with this hunger situation at home. Then the parent could not do much because of poverty. Then he went to library. He just took an initiative, went to library and started reading books. One of those books that became of interest was a physics book. And in one of those books, he came to know how to make a windmill. It was more of a formal thing that had been explained in that particular book. So from the knowledge that he had gathered there at in that particular library, he went home to a scrapyard, and he was able to take quite a number of things ranging from a tractor fan, PVC pipes, shock absorbers, and the bicycle frames and the bicycle generator. And he put up these things together, and he came up with what is now what was known as a windmill. So this particular windmill was able now to power a generator, and the generator was able now to do irrigation. First it was lighting, because they were coming from a background where they even didn't have even a source of light. So it was able to, at the time, bring one bulb on board. Then it came to four. Then from four, it went further. He was able to see even a small TV set, and quite a number of villagers started streaming into his home just to charge their phones. So after that, he developed even, based from the first information or knowledge that he had gathered, he was able to develop a second similar machine, which he attached to the same windmill, and this windmill was now able to power um, a generator, and this generator was able now to do irrigation. And from irrigation, that is them having faced the hunger situation. Now the irrigation came in handy. They were able to plant crops, and these crops were able to now help the family and the entire population. This particular boy has gained fame, and when you look at TED Talks, I think I've seen him there. He has been showcased because when the news broke out, and it had to spread very, very fast, and he got
Mr.
exposure.
Alex,
And
I
yes,
it needs to be closed in 30 seconds because I need to give chance to Madam Diana, and then
oh,
we have
oh,
to
oh,
wrap
oh,
up
oh,
the
oh,
session.
okay. What I'm saying in finalizing is that he was able to uplift the community. So that was how I was now able to link the community. I mean, I was able to link electricity, water, and how it helped the community within that particular area. Thank you so much, Mr. President, and sorry for
Thank
taking
you.
a lot of time.
No, 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 no. Thank you, thank you, thank you,
Yes,
Madam
yes,
Diana.
yes.
Yes, I
Yes,
believe
Mr.
that you
President.
share about health policy and energy policy. If you share some of your view.
Okay, let me quick check. Um, okay, fine. Thank you so much. Good afternoon, Mr. Alex. Also,
Good afternoon to you.
uh, it is open now. I'm waiting to.
Okay, Diani, can you hear me? Can you share some
Yes,
of
I
your
was
view
just
about
checking.
energy?
I was checking the file.
Okay, okay.
Just check a few seconds. But almost. Let me. I'm checking now through what I've sent to you. Thank you. So I've seen a lot of, a policy, health sector policy in our country, which had been approved into various steps, where the main focus in our time is they have included a lot of technology, infrastructures, matters which has been impactful to have advanced tech health in Rwanda. So um, I'm trying to open it. Yeah. I didn't expect to present today. That's why I'm just checking.
Okay, no
I'm
problem.
checking the
So then
file.
tomorrow we're gonna discuss. No problem, no problem.
No, I
You
got
take
it.
your time.
The problem was to check the file now. I have it now in the phone.
Okay, no problem. Tomorrow we're gonna discuss on that particular point. Okay.
Okay, I can present tomorrow, right?
Okay, we can discuss tomorrow. So
Yeah, no
thank you for
problem.
joining today. Thank you for joining today.
Mm.
Thank you. Bye bye and take care.
Okay, bye. Thank you.
Thank you so
Bye.
much. Bye.
Yeah, bye. Thank you.